here. The first here is that the organisms causing peptic ulcer. Okay, peptic ulcer. Peptic ulcer, we already know that peptic ulcer is found in stomach. Okay, so peptic acid is found in the peptic ulcer is found in stomach. So which is the causative? The Clostridium is not, Escherichia coli is also not, and none of the above. The H. pylori is the right answer. It causes what? The peptic ulcer. Then what does Clostridium tetani? That is, everybody knows that tetanus. It is the causative agent of the tetanus. It is a bacteria. What it is? It is a bacteria. Then what does Escherichia coli? It is responsible for. Escherichia coli is responsible for diarrhea. Okay, diarrhea, dysentery. This disorders are caused. Diseases are caused by Escherichia coli. So for this question, the answer is H. pylori causes peptic ulcer. Now next, ABO antibodies are. Here ABO antibodies are. So ABO antibodies, these are divided into two, that is natural antibodies and immune antibodies. Okay, so in natural antibodies there is a contribution of the two, that is IgM and IgG in main factor. Okay, so in options what they are asked, the ABO natural antibodies. Okay, ABO antibodies are immune antibodies. So here mainly there are factors here, this IgG and IgM. So here they have asked, that is IgM is the right answer. Okay, natural antibody IgM or IgG. If IgG was the answer, then both would have been the answer. Let's see the next. Operation theater are sterilized by. Sterilized means no organism is present. Okay, sterilized. So OT is sterilized by, is it chlorine gas, carbolic, formaldehyde gas, or HCr? So it is, right answer is formaldehyde gas. Chlorine gas. What does chlorine gas does? What does it sterilize? It purifies water. What does it do? It purifies the water. What about the carbolic gas? We normally call it phenol. Normally call it as phenol. The surgical instrument. Surgical instruments. Okay, and for HCl is used as disinfectant. HCl is used as disinfectant. Next, shape of cocci. Okay, the shape of cocci. This is mostly confusing, that cocci or the rod or the, what we say, comma shaped, this all. So for cocci we have here, the right answer is, for cocci the right answer is vibrio, comma spiral, comma vibrio, or common vibrio. Okay, for rod shape we get, that is bacilli, we call it as bacilli. Okay, here it is bacilli. And for spiral there is an example, that is Campylobacter jejuni, and here the right answer will be spiral. Cocci spiral is the right answer. Next we will see that the interval between the exposure to infection and occurrence of the sign is the, in this occurrence of the signs, that this is, here they have asked about the infection cycle. Okay, infection. The stages of legacy: first is incubation, then there is okay, immunization, passive immunization. What it came? Okay, this one is the question. So first is first is incubation, then prodromal, then illness, and the last is no. Now here the stage of decline is there. Stage of decline, and the last we have convalescence. Convalescence. So here they have asked between the exposure to the infection and the occurrence of the sign, that is the incubation period. So the right answer here it will be the incubation period. Next, which of the following is used as a passive immunization? For the passive immunization, here most of them might be the answer. Passive immunization, the right answer is human sera or animal sera. Toxoid, here toxoid is, so toxoid comes in the active immunization. Okay, toxoids comes in the active immunization. So here the answer need to be, that is the human sera and animal sera. Next comes penicillin was discovered by. So everybody knows the answer here. The penicillin is discovered by Alexander Fleming. But Robert Brown discovered about the nucleus. He discovered nucleus. Robert Koch, he discovered anthrax. Okay. Joseph Lister, he discovered about the antiseptics. Okay, and the last is Alexander Fleming, penicillin. Right, the last question, that is the infection occurred as a result of the investigation or therapeutic procedure. Investigation or the therapeutic procedure. Okay, investigation therapeutic procedure. So here the answer is latrogenic infection. Latrogenic infection. This is the definition of this. Okay, and nosocomial, we know that is the hospital acquired. Hospital acquired. Cross infection, one person to another. Another. Okay. So all of these will not be the answer. Cross infection will not be the answer. Not even the nosocomial is the investigation therapeutic procedures. Na? So some might be thinking that it could be a nosocomial infection, but no, it is not a nosocomial infection. It is a latrogenic infection itself. It is the definition of the latrogenic infection. Okay, fine. Hope you have understood all the questions.